Aloha! This CME activity is jointly provided by the Queens Medical Center and UH-JABSOM Department of Geriatric Medicine. We offer free continuing education for this series. In order to receive a CME or CEU, participants must complete the online evaluation at the end of the webinar. Your comments are very important to the planning committee and will be used to plan future programs. Health professionals, you can now check your CME credits online. Go to www.queens.org and type CME in the search tool. Click on My CME Transcript, then sign in to generate your transcript. About ECHO, we want to remind everyone that this is an ECHO webinar, which means that this session serves as a forum for mutual teaching and learning from experts and from each of us on the front lines. As the ECHO motto goes, all teach, all learn. So it will take all of you to create this community of learning. In the spirit of aloha, we encourage you to turn on your camera to help build a community of learning. Feel free to eat during the ECHO session. Good nutrition is key to a healthy lifestyle. A little bit about our format. After a short lecture from our experts, we will share expertise from the rest of the team and then open the time up for case discussions. We invite you to share any geriatric cases. It may even be on a topic not related to the topic of today's lecture. We only ask that you keep it a HIPAA-compliant case for discussion. That means, please do not share patient's name, birthday, address, and so on. We learn best from our patients. They are the best teachers. Our interdisciplinary team is here as well, and we are all willing to teach and share our collective wisdom with you. Most of you already know me. I am Lynette Gaylord from ARCA, Alliance of Residential Care Administrators. We have Maribel Tan, President of Foster Family Homes Association. Elsa Talavera, President of All Island Case Management Corporation. May Magnayan, Nurse with Lokahi Case Management. Gabriel Vegalara, Inpatient Coordinator at Aloha Care. Leila Ventar, Health Coordination Manager from United Healthcare, Kauai County. And Dr. Rita Bell Fernandez from the University of Hawaii. We are in the second month of our series on mentation. If you're interested in viewing any of those lectures and handouts, you can find them on our website. Unfortunately, we cannot offer certificates of attendance for videos you have viewed. You must participate in our education live. The title of today's webinar is Alzheimer's Association, Partners in Care and Support. It gives me great pleasure to introduce our speaker today, Dr. Gina Fujikami. Dr. Fujikami is in outpatient geriatric medicine and the division chief of geriatrics at Queens Medical Center. She is also a clinical assistant professor of geriatric medicine at the University of Hawaii. Dr. Fujikami is a board member of the Alzheimer's Association Aloha chapter. She is our local expert on dementia, serving on many panels and conferences. Dr. Fujikami is ranked 90% nationally as a geriatrician and loved by her patients and families. We are so honored to have her speak to us today. Let us welcome Dr. Gina Fujikami. Aloha.
Thank you, Lynette. Okay, well, thank you everyone for joining me today, and I'm sure I know a lot of you as well. And first of all, I just want to say happy National Family Caregiver Month. I know all of you, treat your residents as family, and same thing, I consider my patients sort of as my extended family as well. So thank you again for all that you do. And I'm hoping today that I can share with you some resources on how the Alzheimer's Association local chapter of Hawaii can help you take care of those with dementia, and also maybe help take care of yourselves and your families as well. So actually, let's see, John, if we could go to the second slide. Let's see. how many of you, sorry, while we wait, how many of you have reached out to the Alzheimer's Association or have attended any of their lectures or seminars?
I know I have.
Yeah,
And they've actually come to ARCA's educational conference a few times, and they've actually presented.
great. Okay,
And we'd
very good.
always love for you to come, Dr. Fujikami. Normally, normally we touch bases with Jake. He's the one who normally comes.
Yeah, Jacob Moore.
Yes.
Yes, yes. Yeah, anything I can do. He's awesome too, but anything I can do to help, let me know in the future. Absolutely.
Thank you.
Yeah.
Fujikami, is the slide showing the key points
No, it's still on the last slide.
on the first one?
The last one.
Oh, let me restart it. Hold on.
Okay, thank you. Um, but what I wanted to do again was to share how the Alzheimer's Association can help be a part of the care team of someone living with dementia. I also want to let you guys know about what programs the association has to offer. There's been several new ones that have come up in the past year or two. And then also how to access these resources, not just on Oahu, but all the different islands and counties as well. Okay, perfect. I can see the first slide, John.
Okay, let me go to the next one.
Okay.
Does it show okay now?
No, it still shows the first one.
Strange. Hold on. All right, I'm restarting the file.
Okay, thank you. All right, but maybe I can just do a little bit of some of the introductory slides. So let's see. Oh, perfect.
Is it still stuck on the first slide?
Still stuck on the first slide.
It's still stuck. Okay, let me get out of this view. Hold on.
Okay, no worries. I'll just go ahead and just chat kind of impromptu
Okay.
right now. So, as you all know, Alzheimer's is a growing disease as our population ages. So over 7 million Americans are living with Alzheimer's. Here locally in the state of Hawaii, there's about 28,000 people who have been diagnosed with Alzheimer's, and we suspect that's probably under the number. We suspect it's a lot more. Does usually is a disease of aging, and it does tend to affect females more than males. But it doesn't affect just those who are suffering from dementia. It affects, as you know, their caregivers, their families, their community. Nearly 12 million Americans provide unpaid care. Perfect. Thank you, John. For people with Alzheimer's or other dementias. And this is, again, unpaid care that's valued at over $413 billion if we could put a price tag to it. And this number is just going to increase even to $1 trillion by the year 2050 as the cost of care increases and as we also diagnose more patients with Alzheimer's, and not just Alzheimer's, but any other types of dementia. And while we are doing such a better job of treating and curing other diseases like heart disease, cancer, we are seeing, unfortunately, there's no cure for Alzheimer's. So we're seeing higher rates of mortality, of deaths from Alzheimer's compared to other things like cancer. But, we're hopeful. There's been a lot of new research coming out. So we're hoping that in our lifetime, maybe there will be a cure. But in the meantime, what can we do? Okay, next slide, John. So as I mentioned, more than 100,000 kupuna and others, including their caregivers like yourselves in Hawaii, are impacted by this disease. Next slide. So who is the Alzheimer's Association? So it is an international and national nonprofit organization that really focuses on research, education, risk reduction, and providing caregiver support for those afflicted by this disease. And their goal is their vision is a world without Alzheimer's and all other dementia. Next slide. So just a brief review, what are some signs of Alzheimer's? So we preach the 10 warning signs. You probably have seen this before. It's memory loss that affects your daily activities. You have challenges in solving problems, difficulty completing tasks that you used to do, like cooking rice or something like that. Confusion with what date it is. Trouble like in familiar places, like getting lost in the parking lot. Problems with finding the right words or writing things down, more consistently misplacing things like your keys. Having poor judgment can also be a sign of Alzheimer's, as well as some withdrawal or not wanting to be as social as you used to be before. And then changes in mood and personality are also a possible sign of Alzheimer's. Next slide. So during the COVID pandemic, as you all know, it was such a challenge because everyone was isolated and we were limited on what we could do for those who had dementia and their caregivers. I wrote this article with the Alzheimer's Association in Generations magazine about 4 years ago during the pandemic. And it was really just trying to come up with ideas on how to help the caregivers take care of those with dementia when everyone was supposed to be isolating and staying away from people. So things have changed somewhat since the pandemic has been better. And now the Alzheimer's Association is offering even more support and programs for those afflicted with this disease. Next slide. So what kind of programs does the Alzheimer's Association have to offer? So there is a 24/7 helpline. The number is there at the bottom right-hand screen. 800-272-3900. You can reach any live person at any time if you have any urgent concerns about behaviors, for example, or if you're needing some resources. There is a 24/7 hotline. All of this is free for anyone to access. We do provide educational classes. So not only for caregivers and support groups, but there are also classes for those living with dementia, especially those who are early onset or just recently diagnosed. And then we also offer community education about this disease and how to also prevent it, how to keep your brain healthy. The Alzheimer's Association also offers online training and certification, caregiver support groups, as I mentioned. We do have a local office here in Honolulu, and we have one person on Kauai, one person in Hilo, who are available for one-on-one consultations also as well. So you have a local person, which is nice. Social engagement opportunities. We're hoping to start a monthly coffee hour, maybe even like a walk program as well in the near future, just to bring the community together for brain health and to exchange support and ideas. And then also, if the association isn't able to answer your question, they can always point you in the right direction to other local community resources and information as well. That's the website at the bottom, alz.org/Hawaii. And that's the 808 number is the local office chapter. Okay, next slide. So who can access these resources? So again, anyone can. Doesn't have to be anyone with just Alzheimer's. It could be other types of dementia like vascular or Parkinson's dementia as well. Caregivers or concerned family can also access these resources, as well as those who don't have dementia, but maybe have a family history or are worried about developing it themselves. Next slide. Okay, and then next slide as well, sorry. And I do want to mention that a lot of these seminars do come in different languages, as well as a 24/7 hotline. There is interpreters for 200 languages, so which is very helpful as well. The association also does a lot of outreach. You might have seen them last week at the Senior Expo here in Honolulu. So they're at a lot of health fairs, AARP events, do a lot of outreach at churches, doing a lot of outreach at businesses as well. We call this sort of the sandwich generation, where there's a lot of caregivers who are taking care of their children and then also taking care of kupuna who are suffering with dementia. So they're working as well, multiple jobs. So we've been also outreaching to a lot of businesses and HRs on how to best support these caregivers as well. Again, like I said, local churches and community centers will do some outreach and lectures as well. Next slide. So one of our most popular lectures is the 10 healthy habits for your brain. I don't know how many of you do a lot of these things. I don't. I don't sleep well. I don't think I eat right. But I do challenge my mind by working. I try to run by moving. I don't smoke. I don't wear a bike helmet. I don't bike. My blood pressure is okay. But a lot of things. And like Lynette said, make sure you eat. So we know that, yes, making sure you eat a well-balanced diet is also important habits to keep your brain healthy with or without dementia. So this is one of our popular lectures that we often give. Next slide. And then we also give a little bit more formal lectures as well. So these are some of our lectures that we have given recently. There was one, Dr. Assoc on Kauai Island gave a talk about brain health. There was another lecture online a couple months ago about how to communicate with someone with dementia and with behaviors as well. But we also do a lot of, next slide, John, lectures on caregiver support and conference. So I don't know how many of you have attended this caregivers conference. The one last year featured Teepa Snow. I'm sure a lot of you are familiar with her. And then this past year was with our very own Dorothy Colby and David Troxel. So it was an all-day conference, free again for caregivers to sign up and also to learn about, these were more focused on behaviors and how to communicate with someone with dementia. And the next slide, we also offer research seminars too. So this is, we held our first annual research roundtable this past June at JABSOM. And it was talking about the most recent treatments and diagnostic tests for Alzheimer's, as well again as what are the latest caregiver programs that are funded now, such as at Hawaii Pacific Health under the direction of Dr. Price, and other local research that's going on as well. So we do offer this every year. Next slide. Now I want to focus more on the caregiver support groups and things you may find helpful and beneficial for yourselves. So there's one lecture series that came out in the past year called the Empower Caregiver Series. Again, this is free, offered by the association, both in person and online. It's 6 sessions that about an hour each that are covering 6 different topics. So one is building the foundations of caregiving, what it is, how to maintain boundaries and support, supporting independence, communication, how to respond to dementia-related behaviors, and other support services. So this is a 6-part lecture series. And if we go to the next slide, there's a video I'd like to show about a couple that did go through this series and how it affected them. Yeah, if we could play it. Thank you.
My name is Jeanette, and my husband has early stage dementia. And I tell you, finding this support at the Alzheimer's Association has been wonderful, and I am so glad an organization like this exists, and people like Gina and Ivy and all the other people attending this session. You know, I've learned so much from them and about myself also, and about my husband, and I recommend learning more about something that affects so many people in so many ways. And the Alzheimer's Association is one place, just one place of many that can help anybody, whether you think you need it or not. You know, we all need help. We all can help each other.
And we're very grateful that we came and learned what we learned.
Thank you. And then the next slide is a caregiver talking about her experience as well.
Introduce yourself.
Hi, hello, my name is Valerie Takahashi, and I am so excited about the caregivers, empowering the caregivers. I've attended already 3 classes, and all of the classes were full of information that I wish that I had when I was taking care of my mom and my dad, as well as my auntie. The highlights, I think, is the fact that, you know, Gina, who is the facilitator and educator, she allowed us to ask questions and to then have a discussion about some of the things that we're very concerned about as caregivers. And I thought that was very effective because we had a multitude of people in our group, and they were asking so many questions that we were all able to share our resources together. So I highly recommend this class, and I'm excited about the future of empowering the caregivers and to see more of it.
Thank you, Valerie. Thank you.
Just love it.
And I'm not going to take credit. She's referring to a different Gina who works at the association, who is awesome. She's the main contact on Oahu through the Alzheimer's Association. I call her Little G, but she's one of the main facilitators of these support groups. And then I wanted to show one last video, if I may. And this is from someone who's just gone through a regular caregiver support group. So just caregivers talking with each other and learning from each other. No formal agenda.
So I would encourage everyone, like I did, to call the Alzheimer's Association on whatever island you're on, because when I was going through this, I needed help. I didn't know what I was going through. I was the first of my friends, and so I didn't know what I was doing. So I called the Alzheimer's Association, and I don't know who that gentleman was, but he was so kind and helpful and considerate, and invited me to join them at caregiving meetings. And when I went to those meetings and listened to the stories of others who were there, I'm like, yeah, I mean, I'm experiencing that, or am I going to go through that? It was really helpful, very helpful, the support that I got from the Alzheimer's Association's caregiving group meetings. And I would strongly encourage, if you're able to do it, to take advantage of that.
Great. Thank you, John. Next slide. I mean, as you know, as caregivers, you know, there's no book, there's no manual on how to caregive. And I think the best way to learn is from each other through experience. And that's where, through these support groups, I think you can find them really helpful. And also as a reminder to also take care of yourselves as well. Because, you know, to take care of someone with dementia, it takes a village. It's a 30-hour job. So you also have to learn. I've also learned from these groups to how to take care of yourself as well. Because if you can't take care of yourself, how are you going to take care of the person that you're taking care of? So, so I just want to go into a little bit more nitty-gritty details. So here on Oahu, besides the Empower Caregiver Support Group series, there is the general caregiver support groups like the woman just talked about. So they are held monthly. Here in Honolulu, there is one in person at the Alzheimer's Association office in the Gold Bond building in Kaka'ako, every first Tuesday from 5 to 6:30. We have a virtual one for those on East Oahu on the second Mondays from 7 to 9 p.m. And then on Central Oahu at Plaza, Pearl City, there is an in-person one that just started up the third Mondays from 6:30 to 8 p.m. And then if we go to the next slide, I'll talk about the other islands. So on the Hawaii island, there's an in-person caregiver support group in Waimea on the third Fridays at Tutu's House, Waimea from 2:30 to 4 p.m. In Hilo, in person, third Tuesdays, 1 to 2:30 p.m. at the Aging and Disability Resource Center, and then virtually the first Wednesday and third Thursdays of the month for the Big Island. And then this next slide is just a flyer, sorry, it's a little small, of for example, on Hawaii Island, the groups that they have to offer and the lecture series, so including the Empowered Caregiver support group education program I mentioned before. On the picture on the left was from a picture of the recent AARP caregiver breakfast. And the gentleman on the left is Nick. He is the Alzheimer's Association main person on the Big Island of Hawaii. So he's a good one to know if you're on the island. Next, on the island of Maui, there's an in-person caregiver support group in Lihue on the third Thursday at Puakea. And then virtual one for Maui County, so it includes Lanai and Kauai on the third Wednesdays of the month at lunchtime. In-person Waimea, the last Thursday of the month at Kauai Veterans Memorial Hospital. And then in Kapa'a, in person the first Mondays at the Memorial Hospital. And then, sorry, there's some overlap, but the Kauai support groups, again, there's the virtual one I just mentioned on the third Wednesdays, and then in person, there's another one on the fourth, sorry, that's on Maui, on the fourth Thursdays in Kahului. Sorry, I get the counties all the same. And again, I just want to introduce, so that's Nick Los Baños. Again, he's our main person, educator, caregiver supporter on the island of Hawaii, the Big Island. And on the next, and this is our whole team here at the Alzheimer's Association Aloha chapter. Some of them you may recognize as well. Some also don't do just caregiver outreach, but they also do public policy and research and fundraising events. Next slide. Other services that the Alzheimer's Association has to offer during the Maui wildfires, there was extra funding through the Alzheimer's Association that we were able to give to those who had dementia on Maui Island and to help their caregivers put, you know how the schools were closed? Everyone talked about how schools were closed and what to do with the children. No one really talked about our kupuna who couldn't be left alone, like who would help take care of them. And so we were able to give some funding for day centers and in-home help to those affected by the Maui wildfires. And then there's this new, just this year, Hale Mahaolu, which is a senior housing facility on Maui. They received through the Alzheimer's Association a national grant program to help fund respite services on the island. So those are exciting new developments and other things that we have to offer. And again, these are the three people you need to know. Nick, again, is the gentleman on the left on the Big Island. Little G, Gina Plummer, is our main contact on Oahu through the association. And Cindy Fowler on the right is Maui County, so Kauai and Lihue and Maui. These are the main people who run the support group services, the lectures, webinars. They're your main people if you have any questions also as well. Those are the main people to contact. And again, in summary, this is what we have to offer from the Alzheimer's Association, the 24/7 hotline, education classes, online training, caregiver support groups, one-on-one personal consultations, early stage dementia, programs for early stage dementia, social engagements, and also help referrals to other community resources as well. And that's my end of my talk. And if there's any questions, I'll leave it open for the rest of the time for that. Thank you.
I don't see any questions in the chat, but if anybody wants to unmute themselves and ask a question, please feel free to do that. You know, I'll start off with, I know you mentioned 3 locations here on the island of Oahu. where you folks are located. I'm familiar with the Kaka'ako area. Where in Kaka'ako is that office?
Yeah, so it's the Gold Bond building that's across
Okay.
Between Japsam and Salt, on the 6th floor, I believe, of they're located.
Okay.
Mhm.
I know exactly where you're talking about.
Yeah.
Thank you. That
Mhm.
Gold Bond building's been around many, many, many years before I was
Yes.
born.
Yeah, I don't even know if
Okay.
it's called the Gold Bond building anymore. But and then there was also a caregiver support group on Kailua's side as well, but that's in the process of being revamped.
Okay, and then you also offered one on East Honolulu, but that's virtual. Are you trying to find a location in East Honolulu to have an actual face-to-face meeting?
I think they're open for that. I think it's finding a location and finding a facilitator who's willing. So that reminds me, I also want to mention, if any of you also are interested in volunteering or helping facilitate some of these support groups as well, please reach out to me or the association.
Well, I know when you're talking about going ahead and volunteering, you folks also have the memory walk for the Alzheimer's memory walk. Can you elaborate on that, please?
Yeah, so we had thank you for asking. We had the Alzheimer's walk the other week at Magic Island. It's an annual walk for not only just remembering those and honoring those who are having the disease and their caregivers, but raising money as well and awareness. So they raised over $600,000. I think it's amazing. And it was a lot of fun too, walking around the island. A lot of groups were there offering lots of swag and education and just coming good music. And there was some lion dancing. So it was just a lot of fun. But also to help raise awareness and funds to support programs like these and research.
How far is the walk and what is the route of that walk? I'm just curious.
It's just around Magic Island. So it's not even maybe half a mile. You can do 2 laps, you can do more. And then there's also walks. This coming weekend is on Maui. Maui has their walk at the shopping center. And then Kauai and the Big Island already had theirs as well.
And they all happen annually, right?
Correct. Yeah.
Okay. And do you get sponsors per person? You just get sponsors. That's how it works. Oh, nice.
You can get sponsors. You can just sign up. And we had so many people just sign up, make their own teams and just walk for fun. But we got a lot of corporate sponsors as well. Because again, this is a huge public health issue too, right? And affecting so many people.
So you had something on there about they were offering respite care on the island of Maui. What type of respite care are you looking at subsidizing, or do you folks like put them into care homes and pay the care home fee? How does that work?
I believe it was subsidizing either private caregivers or a private home health aides, or even subsidizing families who are paying them as caregivers while they didn't have a job because of the wildfires and things like that. So it's more subsidizing for caregiver support in those affected by the fires.
So along those lines that you were just talking about subsidizing, so it's been about 3 years ago that through the Hawaii State Legislature, they are paying family caregivers. So are you folks supporting that bill? I know that the AARP is writing a bill again this year, or I believe it might be the Kupuna Council that's writing the bill. I can't remember because I attended both of those meetings. But do you folks as the Alzheimer's Association go ahead and support those type of fundings?
We do. We work closely with the Executive Office of Aging, and of course with the Kupuna Caucus as well, to help support bills like that. Mm-hmm.
I think we have to get all of the different hospitals also. I'm not putting you in that position, but I think that all of the hospitals here locally, considering Alzheimer's is so, we don't have, we need more research, we put more money put forth towards the effort of finding. I hate that. I mean, it's very hard.
I will say, though, over the past 3 or 4 years, so we do have Kobe Chalk, who's our public policy advocate for the Alzheimer's Association. Him and his predecessor have done a great job. I don't know, just a couple of bills that have been approved in the past couple of years. So there's the Silver Alert. I'm not sure how many of you have heard about it. It's much akin to the Miley Alert for children, but for those kupuna who wander, or those who have some sort of intellectual disability, wander and get lost, we do have something akin to the Miley Alert system now. It is almost ready to be in place, but it did get approved the other year, which is great because, you know, time is of the essence, right? When someone with dementia leaves and wanders. So there's a way to activate the emergency system and the local area. So that was approved a couple years ago. Last year, most recently, we got approved where now with that part of the annual wellness exams for Medicare, now there's a standardized memory screen and testing that providers can do now to help try to early detect dementia. So there's a lot of, and there's a couple of things coming up now too on the legislature. So there's a lot of interest, and we're hoping at some point to develop our own dementia research center here in Hawaii in partnership with John A. Burns School of Medicine. So a lot of exactly what you're talking about, Lynette.
So that is interesting, the Silver Alert. So who is going to do that? The city and county? Is it going to be run like the Amber Alert?
It's going to be run like the Amber Alert, correct, with the local enforcement.
Nice. Okay, so there are two comments in the chat box. The first one is from Stacy. She says, this is Stacy from Maluhia, and she wants to share a resource for adult day health in our chat box. Is that okay?
Yeah, absolutely.
Please go ahead, Stacy, and go ahead and share that. And then we have a question from Janelle. It says, what type of services does Alzheimer's Association can directly help our care home residents with? And what are the criteria for them to qualify? What is the process of referring them to those services?
Yeah, so there's good questions. So there's no qualification. I mean, again, like as if your resident has some sort of memory problems with or without an official diagnosis of any type of dementia, you can feel free to access the Alzheimer's Association. You don't need a referral officially from a physician or anyone like that. You could just feel free to call the numbers for the association. And then usually in terms of as a caregiver or care home operator, you could call the association if you have questions about behavior. I get a lot of that about how to manage certain behaviors. If you need more information on other community resources like day health centers, other programs as well in the community. And also any just general questions about treatment or things like that. If you don't feel like you're getting that from the physician of your resident, you can always reach out to the Alzheimer's Association for that. Or if as a caregiver, you're just feeling a lot of stress for yourself and burnout, and just need someone to talk to or need some advice, they can also help with that. And I would suggest to call them.
Definitely. Okay, so we have two shout outs. One from Norma Tenorio. She says she has a resident at her care home, 102 years old, and she wrote a book and it was published when she was 90 years old. Woohoo! Yep, that's a good one. And then another from Stacy. She went ahead and she said Maluhia Adult Day Health Center. And they're working with a lot of kupuna with challenging behaviors. And she says, feel free to call out to them. Yeah. So I apologize, but I want to go back to the Silver Alert thing. So is that going to cost like you have to apply to get into this, or it's just going to be free? So if we just have the problem, we just call it. Oh, nice to know.
Just call like 911.
That is great. I think that'll ease a lot of our pains, since we can't physically lock our gates to keep the residents in. You know, I'm going to tell you a story. I had a resident that was yelling out for help, literally, because he likes to stay outside, asking the people walking by, to come in and, just help him out. And we're like, okay. So people were actually walking in and trying to help him out of the gate to go walk around. So I now have a huge sign on my gate: do not open the gate, please. I was like, why would you do that? But that was my 2 cents for the day.
Yeah, I'm sure all of us have stories about, yeah, the wandering and just, oh, yeah, need to go to work or, need to go home.
Yeah.
Yeah, and it's challenging because a lot of them are still physically fit. Some of them are, right, but they're mentally, it's challenging. So it's hard. Like you said, you can't restrain them. You can't,
Yeah.
so sometimes you just have to, yeah, alert the right authorities. Now we have, again, a more streamlined place through the Silver Alert to really get effective authorities and tracking sooner. And again, it's all free.
So Norma is asking if the person we spoke about published a book, if he's a good candidate for research to look at, or at her profile, I apologize, and how she did on her life that might be able to contribute or help the research program in terms of her lifestyle or food she was eating.
Since we don't have a cure for the disease, we're now, a lot of the research is looking at prevention, right? How to keep the brain healthy so you don't even go down that path of developing dementia. So trying to find lifestyle habits or good luck or good genes or what the secret sauce is a lot of the focus now on research.
So Melita is asking about, again, the Silver Alert, but it's not up and running yet, Melita. She's asking if you just call 911 and ask for the Silver Alert. That's how it's going to be working, right?
That's the hope. Yeah. Of course, the bill was approved last year, but it's taking a little bit of time to work through the proper authorities and training. So as of right now, it's not in effect yet. But I suspect it will be just like that. You call 911 and you just explain the situation. They'll know, the operator will know what to do and the right activation.
I think that'll be a wonderful asset, especially for caregivers in care facilities, care homes, foster homes. As a hospital, say Queens Hospital, does Queens offer, I know Hawaii, that the University of Hawaii, they do a lot of research for Alzheimer's. Do any of the hospitals go ahead and fund or give money to UH so that we can go ahead and have any kind of progress with this research?
Far as I know, no. I think a lot of the research, there is some research being done at the University of Hawaii, both lab bench work and also general lifestyle. Like there was a recent study that came out about hula and how it's good for the brain and helping preventing cognitive decline. As far as I know, I don't believe so, but I do know there's like Hawaii Pacific Neuroscience, run by Dr. Liao. He's doing a lot of research and has a lot of grants as well. But in terms of the individual hospitals, no. That's why we'd love to have a dementia center, much like a lot of the other academic centers on the mainland have, where we all come together and pull our resources and brains and everything to try to help facilitate better research here in Hawaii. That's the dream.
Yeah, I'm going to go on a tangent only because you know me, I'm always on tangents. But anyway, I admitted someone recently that has progressive supranuclear palsy, and it's really, this neurological disorder is, oh my gosh, it's devastating to watch. Do you find that it's directly associated with Alzheimer's or dementia?
So supranuclear palsy is a type of dementia, one of the more rare ones, but I think it's more common than we think. Yeah, a lot of visual balance issues. It's a little bit more rapidly progressing. So as of now, it's not related to Alzheimer's, but it is a variant of dementia.
Thank you. Anybody else have any comments, questions?
Or any suggestions on how you guys feel the Alzheimer's Association can help you as well? Because again, our goal is to try to be part of the care team for the resident. Is there anything that you feel that there's something that we could help with that's not met?
Dr. Fujikami, this is Rita Bell. I have a question about the safe return program and the alert. Can you why is there advocacy? I feel, instead of the PERS unit, Medicaid pays for the PERS unit. Who pays for this? Is this out of pocket? And could we get this covered by our MedQuest division?
So it's more like it's not a device. There's some, I know there's some other devices besides the PERS out there, but it's more just it's a program within our local law enforcement. So again, it's just like the Miley alert, the Amber alert. So again, the ideal how it would work is it's a free program, but what it is that it's a way to streamline when a person goes missing and you alert the local 911 or authorities. It automatically will go through this pathway where it'll alert like the police, it'll alert maybe with the cell phone service in that area where the person went missing to send like text alerts. You know how you get sometimes those text messages on your phone that a child is missing in that local area. So it's more to try to facilitate awareness of the community and local resources to find that person. Because right now, when you do a missing persons report, it takes what you need 24 hours. And again, 24 hours, who knows where that person is by then, right? So this is a way to hopefully avoid that and just get things done more quickly. So it's not a device or anything like that. And this program is in other states as well, the Silver Alert.
Yeah, in the past, I recall it was like because it was a partnership with MediAlert, and it was around $45-50. But I had my Cocoa-Colee Valley patients got that free many years ago because of there were grants from the Hawaii Community Foundation. So in some ways, they didn't have to pay for it. But I recall in the past for the safe return, because you have to get a bracelet or one of those necklaces, and I remember there was some cost associated, and I could never understand why, our MedQuest, if they pay for a PERS, why don't they cover this one? But they don't.
I agree. Yeah, and I'm not sure either why. Yeah, I agree. Although I find too with the PERS system, I mean, I think it's a great, much needed, or the Apple AirTag or the Tile. But the challenge I find with that is that the person takes it off or refuses to wear it. So I think that's why this sort of Silver Alert, hopefully, and someone who just doesn't have any ID or takes off their Apple AirTag or whatever, is a way to help try to keep them safe.
Dr. Fujikawa,
Go ahead.
I just wanted
No.
to add that for the PERS unit, it's actually mainly for folks that are alert and know how to use it. So it's for fall prevention, not prevention, but in case they have fallen and they need help. So it's for folks that are alert and oriented, not for folks who, with
no, and you're absolutely right. You're right. The person is like for falls when they fall and then you push the button. Yeah. Some of them though are a combo GPS locator though. Sorry, that's why I kind of group it in together as well. Yeah.
That is correct. There is a fall detector. So if the person cannot press it, if they have fallen, there's a way for the company to monitor if a fall happened.
You're right.
So again, Janelle has a recommendation. He's asking for a recommendation. What is your recommendation if a prospective resident has an exit-seeking behavior or history of? If our care home is not a locked unit, is it best to decline? Maybe refer to one of the locked units that are available on the island?
Oh, that is a tough question that I deal with too. I mean, yes, there are the locked memory units in those facilities, but I have quite a few of my own patients who are wanderers, and I think there's always the risk, but some ways to manage the wandering behaviors are, of course, right, having video camera alert system on your door, maybe hiding the door behind a curtain or something to hide it, camouflage it, so the person doesn't know it's the front door and hopefully won't leave. Are some ways around that. but it is tough. And of course, we try to avoid medications as much as possible, given the side effects and falls risk. So it is tough. I know some of my families have done like the baby gates as well, but those are some suggestions. But I have had residents who wander, but the caregivers are able to find ways to keep them safe in partnership with some medications if needed.
Thank you, Doc. Also, Melita says she's sharing, she uses a device finder tag to monitor wandering patient. The device finders are attached to the walker or the cane or the wheelchair.
Yeah, that's a great idea. Or have some people put it in their shoe. I don't know how they do that, but under the lip of the, I don't know. Yeah, these are great tips.
Well, I really wish that they would get that silver alert up and running. That would relieve a lot of my stress personally, but yeah, I don't know what it would take to do that, but maybe Alzheimer's Association or AARP, Cool Council, they can go do some knocking on some doors at the legislature to get this up and moving.
Yeah, yeah. Again, it is approved. The funds are there. It's just working through the different
bureaucracy. Yes. You didn't want me to use that word. Sorry.
I didn't say it.
Dr. Fernandez, did you have any additional questions?
No, we can move on to Layla and the evaluations. John could pull up that slide, please.
Thank you, Dr. Rita Bell. And the evaluation link is in a chat. So for everyone attending, you can go ahead and click that link, which is in the chat if you want to do it now. So this evaluation has to do with mentation. Again, it's a similar procedure that we've been doing. So depending on how many residents that you have in your home, start with the resident that you admitted the first admission, and then your second, and then and so on. And if you could please answer A, B, C, D questions, and when you're done with the resident one, then proceed with the second resident, and then third and fourth if you have four or more residents in your home. Do we have any questions about the evaluation? Is everyone understanding this, and have you been all doing it, or have you had any challenges in completing it? Please let us know.
Laila, could you explain to them what are these questions? What is
Sure.
the 88?
So I might need your help, Doctor, on the 88 for cognitive screening. So this is the first I'm hearing it too, 88 for cognitive screening. Do you mind helping with that?
Yeah, these are cognitive screening tests. So we want to know whether your resident has had a evaluation for dementia, whether they've had an evaluation for depression. Now, this often occurs when they go to see the doctor. Maybe they've had an 88, maybe they've had a mini cog. So we're looking more to see if screening has been done or not by any of the health team. Thank you.
I know Dr. Fujikami was saying that they have some type of questionnaire that they're offering. Is it this 88 dementia screening that they're offering now with your annual?
No, it's just recommending. So for the annual wellness visits for Medicare patients, it's just recommending that PCPs do some sort of standardized questionnaire. The 88 could be one of them, or it could be a mini cog, or if there are memory concerns like the MOCA or MMSC. But before, there was no real standardization. It was basically Sometimes the doctors would ask if the person had memory problems, or they wouldn't. They would just kind of guess. Now we're trying to standardize that, where they actually have to do some sort of mini assessment. So the 88 could be a possible one.
Is that with just a PCP or is it with a geriatrician?
With the PCP for the annual part of their annual wellness visits.
Thanks, Doc.
Thank you for that explanation, Doctor. Again, so if you would like a copy of your certificate of attendance, please make sure that you complete the evaluation and make sure that we have your correct email addresses and the correct spelling of your names. And it will be sent to your email. So if you don't see it in your email, check your spam folder if you don't see it. Again, it's one evaluation per person, so it's not a group. It's not a one evaluation for a whole group. So you have to complete the evaluation.
Certificate of attendance.
Mm-hmm. We want to thank you for being here today, and thank you, Dr. Fujikami, for your beautiful presentation and for the resources that you provided. And thank you to our caregivers for all your hard work.
Yeah, I want to extend a special thank you to our guest speaker, Dr. Fujikami. She is volunteering, just like we've had all the speakers throughout the year. They are not paid, they volunteer, they give their time, their love, and they give their wisdom and share their knowledge with all of us. I extend our big thank you to all our experts that have come to teach us about the 4 M's of healthy aging. I want to also extend my big thank you to the team. Here at UH, we have John, who is behind the scenes. He is our IT expert. He's also like a DJ. He gives us good music too. We have a lot of people on this team, from Juanette, Maribel, Elsa, Layla. We have Gabriel. So many people are helping us make this a good experience for the ECHO sessions. And last but not least, we thank you all as caregivers. You have extended your home and your hearts to our kupuna. We could not do this. The state of Hawaii does not have enough nursing homes. Absolutely not. So if you were not there to open your homes, I do not know what we would do. So big thank you and happy Thanksgiving to you and your families. Wishing you happy holidays.